teenage rhinoplasty. You know, I think a long time ago it was sort of the idea that it was almost a coming of age. You turn 15, 16, whatever it is. If your nose is an issue, your parents bring you into the plastic surgeon and talk and say, hey, do a nose job for this person. So we wanted to sort of address that, physical maturity, emotional maturity. What's the things that we want to talk about when it comes to teenage rhinoplasty?
Yeah, number one question in everyone's mind is, when can I do it? How soon is too soon for my child to have rhinoplasty? And the answer, like Dr. Solieman said, is really multifaceted. One is about physical maturity. We want the nose to be fully grown or almost fully grown before we think about making changes, because if you disrupt the nasal growth plates and areas that are important at too young an age, that can interfere with future growth of the nose and might cause the nose not to grow the way it should. And so there is a general age that we think about rhinoplasty being appropriate.
Yeah, typically for girls and women, we talk about at least a couple of years after the menstrual cycle has started. So that can be as early as 14 and 15 from a physical point of view. We look at other factors, how tall they are, how tall their parents are, where the growth cycle is, and that's particularly important with boys as well. So all of those things go into the discussion, and when you come in and we talk about it, it's obviously an individualized conversation with respect to physical maturity.
The really other important question is one of emotional maturity. Rhinoplasty is a surgical procedure, and not just any surgical procedure, it's one that alters your appearance, and so it's really important for teenagers to be in a place from the point of view of having a sense of their own self-identity, their body awareness, and having the comfort and confidence of knowing the kind of change that they want to create, what they're going to be comfortable with, and us getting a sense that they're mature enough to know the kind of choice that they're making.
Yeah, I think that's probably the thing that we stress even more than the physical maturity question. It's really important when you're contemplating, look, teenage years are difficult enough. The last thing you need is another source of stress with potential bad rhinoplasty and how awkward that could make a patient. So what's more important really in our experience is, you know, are they aware of themselves enough to be able to say what they like, how they want to look, how they want to present themselves. You know, it was very common back in the day, the surgeon knew best. He would say, I'm going to do this. The patients were quiet, they didn't say anything. The surgeon had the final say on this. We think it's really important for the patient, for teenage patients, to be able to talk about what their comfort level are, what they want to look like. You know, the old days where you kind of had that scoopy, kind of cute aesthetic, we largely try to talk those patients out. You know, it may feel age appropriate when you're 15 or 16 years old to have that scooped out bridge, but as you get older, a lot of those patients ended up saying, hey, you know, I don't want to be cute anymore. What do I have to do? And that would necessitate a revision.
Yeah, we find teenagers these days are really very advanced. They often come in kind of having a good sense of who they are, what they want, what they're looking for. Some may even have their own imaging or their own pictures they want to show us. It's really important for us to have an interaction with them and their parents as well, and really understand the motivations. The most satisfying result from surgery will happen when teens come in and they're really motivated for themselves to make this change. Like Dr. Solieman said, sometimes those teenage years can be awkward, and if the nose really feels out of place compared to the rest of the face, that can be a real source of insecurity for a lot of teenagers. And making that change at that 15, 16, 17-year-old age can make a huge difference in confidence. But it's really important for us and for the patients that we really understand that it's themselves who are motivated to make the change, and not mom or dad who are saying, oh, well, you know, we're going to come in and you should have this done.
Yeah, final word on that, really important on that last topic that Dr. Litner brought up, because I think it's probably one of the most important things is when we do the imaging, I largely often will turn to the patients and say, you know, at the end of the day, while you have to respect the parent's opinion, the way we know that you're ready to do this is you have to have your own opinion. You have to be able to say, Mom, Dad, I know you think this look is better, but I'm comfortable with this. Ideally, obviously, you all agree as to what the aesthetic is, but you have to have enough of a sense of the self to be able to say that for yourself.